Now, a lot of women check their breasts, and that has become a normal part of our lives, and the shame and stigma around that has gone. However, there is still a lot of taboo around talking about our intimate health. Hi, I'm Dr. Shirin Lakhani, and I'd like to speak to you about checking your vulva. So I want to encourage every woman to start checking their vulvas from an early age so that they can recognise what's normal for them and they can pick up early when something's not right. So this is my crocheted vulva. So I'm just going to explain the different parts of it. The outer lips are called the labia majora, okay? And then the inner lips are called the labia minora. Now, both of these vary in appearance from person to person, and there is no normal way for it to look. So this is why I encourage women to see what's normal for them, and then they can determine if things change as time goes on. This part here is the clitoris, and what you see here is what we see externally. Now again, clitorises come in lots of different shapes and sizes and vary from person to person. What you don't see is the internal clitoris, which is there. So as you can see, the majority of the clitoris is inside the body, and there's a lot more to it than was previously thought before the advent of MRI. Then moving down from the clitoris is the urethra. Sometimes this sits inside the opening of the vaginal canal, and this is where urine comes out of. And then below the clitoris is the vagina, which is the birth canal, and below that, this tissue here between the vagina and the anus is known as the perineum.